The healthcare sector in particular has a number of challenges. One is around driving additional performance out of its resources, having kind of maximum kind of performance delivered from both its physical and its human resources, both clinical and non-clinical staff. And we're seeing lots of demands placed on that when you add the budget constraints that many of the health organisations are under across the country. Lean and Perform are able to really help address some of the challenges within healthcare through making sure that we're getting the right people doing the right work at the right time. So we do a lot of work with organisations both in the clinical side and the non-clinical side, really understanding what are people working on, what are the patient priorities and the organisational priorities, and aligning those with some of the practical tools and techniques. And what we're finding is that by aligning those and making performance clear and transparent and engaging the frontline teams in owning the ongoing improvement, that we're seeing really incredible performance improvements in relatively short periods of time that are sustainable and don't require huge technology investments. One of the things that we find to be very effective in applying lean in the healthcare environment is that healthcare as an industry has some of the finest problem solvers anywhere in the world. They're trained to solve clinical problems and patient problems as a matter of course, and we find there being lots of success in helping just apply some of those approaches that people are well versed with that are very similar to kind of lean and continuous improvement approaches, but applying those to the business problems, not just the patient problems. And we're seeing some fantastic results of engaging the frontline teams and applying those great clinical problem-solving mindsets to their own problems, not just the patient problems.